welcome back to another insightful episode of MedSynapse podcast series, where medicine meets meaningful conversation. I'm your host, Tetvi Shah, and today we're decoding a part of the body that is essential to everything we do, from standing tall to simply scrolling on our phones, the spine. And we're not just talking about the posture tips, we're going beyond into what Spine 3.0 really means, the future of spinal care through smart, preventive living. And joining us is someone who does not just treat spine disorders but is passionate about preventing them. Dr. Deepak Joshi, an exclusive spine surgeon with over 14 years of experience, trained at institutions like Harvard and Ames in Delhi. He's here to talk about Spine 3.0, a smarter way of living to protect, preserve, and strengthen our spinal health. So, Dr. Deepak, thank you so much for joining us, and it is such a pleasure to have you here with us today.
It's nice to be here. Thank you very much.
Doctor, let's start with the big picture. So, what are the fundamentals of good spine health, and how do common lifestyle factors contribute to spinal problems that may escalate to the point of needing surgery?
So, I have a very different point of view. If we have to understand the fundamentals, we need to know what is the role of spine in our body, why is it made so, and why do we have problems. So, if we go to the fundamental, a spine is basically a structure where the vertebrae and the discs are holding together. The disc gives the flexibility, the vertebra protects, it's a bone, it protects the spinal cord. So basically, this is a structure which is protecting the spinal cord and also giving us the flexibility. But as we know that we have evolved from animals, and then first fishes, reptiles, and then animals. All these animals were basically four-legged. In fact, if you see that if we see the fishes basically swim, so they have no impact on their spine. They never have spine issues. Then the four-legged animals don't have to stand erect. But we, because humans are walking on two legs, there is always a load on the spine. And that is the source, the beginning of the disc or the spine problems.
Yeah, doctor, that actually really puts things into the perspective, and it's actually also a wake-up call for all of us.
So, we expecting that we will not have spine issues throughout our life is something expecting too much. We need to know that because humans are doing a lot of other things, this is a compromise we are paying because we are standing on two legs. Now, what has changed in last, and why I'm saying spine 3.0, because 1.0 of spine treatment was, with the Ayurveda people, our ancient learned gurus who identified, this is the problem you can have, and these are the preventive steps you could take. And, that was helping us a lot. But our ancestors didn't have much problem because they were doing a lot of hard work. The diets were different. The lifestyle was different. Spine 2.0 is with the advent of modern science and technology, having CT, MRI, X-rays, the surgeries. We know, okay, when you have this problem, then this can be treated in a surgical way or a medical way. When I say about spine 3.0, it means that let's go beyond that. Let's go to the fact that we don't have a disease. For that, we identify that we are living in a modern world where if we see, the humans have been on earth for lakhs of years now, but lifestyle has dramatically changed in last 50 years, though our genetics, our body structure has not changed dramatically in last 50 years. We never had refrigerators, so we never had food available with Swiggy, Zomato, and microwaves. Whenever you come, you have food and eat. That people were following the circadian rhythm. They were having good sleep. They would never have to get up in the night. And office jobs, desk jobs were never there. So they used to do a lot of physical activity, eat food which was normal and good for their health, and they were never overweight. So these problems never arose. The extent of the problem which we are facing is much more than what they were facing, and it's a wake-up call for every one of us that we get up and do things so that, in the modern lifestyle with the modern challenges, we can prevent diseases, especially of spine disease.
So now, doctor, you advocate for prevention. So, what daily habits or routines do you recommend to keep the spine healthy and resilient? And how does the concept of Spine 3.0 actually fit into this?
Yes. So once we have identified the fundamentals that we will have spine problems, and the modern lifestyle is very artificial, we need to know what can we add into the modern lifestyle so that we don't have diseases as often as we are having now. Most of my patients, when they come to me, everyone is saying we have a sitting job. And my answer is that no one in the city is there who does not have a sitting job. Even a shopkeeper is sitting, front desk is sitting, bank officer is sitting, doctors are also sitting. If you're working in a city or a town, then you have a sitting job. This is the modern bane. Then a second example I give to them is that we are working so that we can have a social lifestyle, we can have financial freedom. And this is basically our modern way of earning. So when you are earning, it cannot be earning for 1 year or 2 years. It has to be lifelong. And the examples we have to learn are from the athletes or cricketers, when they have already performed well for 1 or 2 years, and many of them don't realize, but the stars realize that if they want to be a star for next 20 years, they have to work on their fitness. For that, you need discipline, acceptance that you need fitness, making changes for the fitness, and then working on it on daily basis with discipline. So my suggestion is first accept it and then give time, at least 1 hour every day besides your work, for fitness. Whether you are a housewife, whether you are an office goer, you need that extra 1 hour in which you work on your fitness. Now, what fitness is required to keep your back healthy? First is do everything which avoids you getting overweight or obese. You have to develop muscles and prevent fat deposition. Because even if you are not overweight, but you don't have muscle strength, core muscle strength, and the weight is basically of the fat, then there is no support to the back, and you will have back pain, aches, and everything. So we need to develop muscle mass. For that, you need to walk regularly and do core exercises, which can be even without weights. You don't have to go to the gym for that. And then we have to increase the strength plus flexibility, which means to increase flexibility, you have to stretch your hamstrings, stretch your back. And the easiest form of exercises I would suggest is yoga exercises, because they not only help you increase the endurance, but also flexibility. Then one should avoid all those diets where there is increase in inflammation, like sugary food, a lot of mayonnaise, pizzas, burgers, because they in fact increases inflammation and get us into a metabolic disorder. And metabolic disorders are not just related with diabetes or blood pressure, they affect your body in a whole totality. So basically, in the modern lifetime, once you are aware, you can take care of your food, sleep on time, because sleep is very important time for your recovery of the muscles as well as the brain cells. And being mindful of your activities and stress, and taking extra time out for exercises, which can be just walking, running, but do all type of exercises, just not walking, can help you slowly get back and prepare you to handle the modern lifestyle.
Yeah, I think Spine 3.0 is not just about treatment, but it's like a mindset shift also. And I think minor lifestyle changes can actually help go a long way also. So now, doctor, can spine surgery be completely avoided in some cases? And when is it truly necessary? And based on your experience, how successful are these procedures?
There's nothing perfect. Even if we do the best of the things, you cannot change the luck. If you are unlucky, you will be in trouble. And all the troubles never come with an invitation. So it's always come. So if someone has a spinal trauma, they need a surgery. If someone are born with a congenital defect, which is worsening with time, they would need a surgery. If suppose, you lift any heavy weight and you have a huge disc prolapse and that is causing a lot of pain, numbness in the legs, weakness in the legs, which is not getting better or is disabling, you will need a surgery. You have a tumor in the spine, that will need a surgery. Or you have a cervical myelopathy, which is causing weakness and gait instability and is going to worse with time, you need a surgery. So spine surgery is not totally avoidable, and one should never live in a delusion that, oh, I am doing this, I'm eating this medicine, I'm eating this special supplement, or I'm getting this therapy. This is going to totally prevent a surgery, because then you're wasting important time. And spine surgeries are always done when you have least disability, because nerves cannot be repaired. Once you have damaged your nerves, cause permanent damage, then you're disabled for life. But if you remain flexible, if you develop your core exercise muscles, and you know that you don't have to sit in one position for long, because sitting in one position for long, sitting on low seats are troublesome. If you're taking those preventive measures, the chances of you getting into a situation where you need a spinal treatment or surgery is less. In the modern days and times, with the advent of MRI, CT scans, navigation, robotics, and understanding of the spine surgeries, we really are, working. We know what is the cause of the disease. We know which are the targets to be hit, and the surgeries are very precise and very rewarding. So, if anyone who needs it should not shy away from it and not just become bedridden without a surgery, because there are treatments which are very successful and available.
On that similar note only, doctor, as you also mentioned that many people live with chronic back pain and surgery feels so inevitable. So what are some early warning signs that should prompt lifestyle changes instead?
Yes. So there are two things. One is you have a chronic back pain. So chronic back pain never can never be treated. If chronic back pain alone without any other symptoms can never be treated with surgery. That has to be managed with lifestyle. Now, what is the most common problem which we are facing nowadays, especially with the people who are getting more than 50 years old, is sarcopenia. What is sarcopenia? Sarcopenia is basically, we are so busy in our lifestyle. This is not the definition of sarcopenia, but I'm just giving a background. We're so busy in earning money, taking care of our families, that we don't give time to ourselves, and we are eating anything. We are not developing muscles. So we only have fats. The muscles are not working. So the patient will slowly and slowly over the period of years start having back pain, and they become weak. They cannot get up from the seat. They can't walk long. They have tiredness, and then because their body is giving a signal that, oh, you can't walk, so they take more rest. They avoid doing things and they become more weak. So such patients cannot be treated with the surgery. All they need is realization something has to be done, good food and regular exercises, and get their muscles back. But if someone is having chronic leg pain, radiating pain, which is disabling, whenever you get up, there is a disabling pain in the leg, like sciatica, numbness. You can't walk on your toes because of the weakness. There is a loss of sensation or numbness in and around the area of buttocks. And gradually your walking distance is decreasing. You can't grip your hands. You have instability of gait. Then, you have to find the reason why you are having this. We have tried everything and you're not getting better. So in that case, you need a surgery. These are the warning signs. So loss of blood and bowel control, numbness, which is progressively increasing, unable to grip your hands, unable to walk on your toes, decreasing walking distance, severe sciatica-like pain. These are common symptoms.
Yeah, I think that's really interesting, in recognizing those early red flags could have actually saved someone years of pain also. Now, doctor, let's talk about and touch upon osteoporosis also. Like osteoporosis often flies under the radar. So, how serious is spinal osteoporosis, and at what stage should prevention efforts ideally begin?
Yes. So there are two parts of your questions. One is, what is osteoporosis of the spine? How serious it is, and what age should it be? We should be serious about it, when we should start preventing it. Osteoporosis of the spine, first of all, honestly, doesn't have any symptoms. Because what is osteoporosis? Osteoporosis is just weakness in the bone. So your bones are slowly and slowly getting weaker. And they will not present as pain, because anyone can have pain. You can have pain because of so many reasons. It's not just because of osteoporosis. Because you're having pain, you get MRI, you can have a disc bulge. You get your bone density done, you're already 70 years old, you will have osteoporosis. That doesn't mean that the weakness of the bone is causing pain. It will not cause pain. You will have pain because of osteoporosis of spine if you have some hairline fracture, microfracture, or osteoporotic fracture of the spine, which is very common in nowadays. Because as our aging population is increasing, and especially in cities, you have retired people who are retiring, and they're living more than 70, 80 years. The bones are weak because they have always worked on a desk job. Their bones are weak. And once you fracture your back, then you are disabled for next 3 months, even if you don't have any surgery for that. Then first 3 months you have a lot of pain. Then you have nagging pain because the muscles are rehabilitating. So your 6 months are just gone, and you will never be back in shape as you were before. Which doesn't mean that you will be disabled, but you will be having some residual pain. Now, if you have osteoporosis, you have first fracture, then there are 20% chance you will have a next fracture in 1 year. So imagine, someone who has osteoporotic fracture already spent 6 months rehabilitating, and then next year you have another fracture or a wrist fracture, hip fracture. Every second year you are just spending 6 months rehabilitating. This is life, no one wants to have. Just because it is not happening like a heart attack that you have to take a decision, you ignore it. And there are so many opinions that people are confused what is the best step.
Right.
So one has to recognize that osteoporosis is a slow killer. Rather than a killer, it's a very annoying disease. Someone who is 80-year-old, is lying on the bed. The whole family is stuck, because you can't ignore a old person in pain, but you can't go to work, and there is no immediate solution. And this happening again and again every year or every 2 years is really annoying, and it disrupts the whole family. So it's a serious problem. It's better prevented. So now, what is the best age for prevention? The quality and the density of the bone, the foundation is laid till 25 years of age. Whatever bone quality and the density you have achieved in first 25 years of your life, that is the maximum density you will have, and then only it will decrease. So first 25 years of life are very important for the rest of your life. In that, the growing period from in adolescence and puberty is the second most important, the most important part, because then at that time the bone grows very fast. And if you have dietary deficiencies, you're having, in modern days people are girls and boys both are having a lot of junk food, Coca-Cola, then you get carbohydrates, but you don't get nutrition, you don't get protein, you don't get calcium. The foundation is bad. No matter what medicine you take after that, you cannot survive, you cannot escape the problem.
Right.
So,
Very right.
So my message is, if you have girls and boys in your kids at your home, please take care of diet. Let them exercise, good sun. See if they have vitamin D deficiency. You can also give them calcium supplements, because that is the most important time. You cannot think, oh, bacha hai, isko khane do jo khata hai. Because if they are full with junk food, they will never take nutritious food.
Very
And then the time is lost. Second most important time is at the age of 40 years, especially in women, when they have hormone changes. At that time, they don't understand the symptoms, because they're generally slow, weak, and they tend to avoid things and don't discuss with anything. At that time, you need calcium supplement, you maybe need hormone replacement therapy, you need to check your bone density and make corrections, whatever is required. But there's no substitute for exercises. No matter how much calcium you take, no matter how many medicines you take, but if you are not doing muscle building exercises, you are not working against the gravity, the calcium and the protein will not get deposited. To explain that, the swimmers versus the sprinters, if the swimmers have less bone density than the sprinters, just because they are not using the gravity, While sprinters are running against the gravity, their muscles are built, their bones are stronger. So if you are not working, you're not exercising, no matter what supplement you take, it's not going to work,
Correct.
right?
So it is.
So,
It should be
so
balanced.
at 40 years of age, people slow down and they take slow down as normal aging process. At that time, you have to not listen to your mind, do a lot of exercises, take calcium supplements, get your bone density checked, and not let it fall down. And that should continue after 60, 70 till the time you are living and happily living. Keep on taking calcium supplements. Go to a doctor, see if there is any metabolic disorder, vitamin D deficiency, thyroid deficiency, diabetes. Don't stop activities, and whatever is recommended, you can take medicines to build up your bone density.
Yeah, it's really interesting to hear that actually. Now, Doctor, finally, are there any specific success stories that highlight how lifestyle interventions have helped avoid surgery?
So when, as a spine specialist, when I see patients, they come to me, they already have a disease. A lifestyle can only prevent a surgery if you have taken care of yourself right from the beginning, not after the disease has happened. But as a specialist, whenever a patient comes to me, I always ask the patient as well as myself, does he really need a surgery? Is there anything which he can do or she can do to prevent the surgery? So most commonly, when the patient has sciatica because of the disc prolapse, we realize that these are the things which are sometimes self-curing, self-remitting. So if at that time, the most common problem is, which I've noticed, is that the patients who have a newborn at home, once they become more than 4-5 months old, they are about 6-7 kilos. And that time they lift them and the discs are already weak and they develop a sciatica. So we tell them, don't lift the child, don't lift any weight, reduce your weight, don't sit at low seat. And once they make these modifications, then the body starts healing and they can avoid surgeries. But you have to really talk to the patient, identify what is the trigger. And once we remove the trigger, many a times at the early stage, we can prevent a disease from worsening to leading to a stage where need a surgery.
Yeah, stories like these are really motivating, and I think everybody should take a step forward and do some kind of lifestyle changes and accommodate lifestyle changes in their daily routine. So, Doctor, thank you so much for this eye-opening and practical conversation today. And I think Pine 3.0 is more than a concept, it's like a toolkit for long-term health also. So, thank you so much for sharing that takeaway with us today.
You're welcome. It was nice to be here. Thank you.
And to our listeners, whether you are a surgeon, physician, or health conscious professional, this episode is a reminder that your spine deserves daily care. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay well and stay aligned.